Did you guys get snow where you are? Because we haven't really had any. It's kind of weird because they're talking about it.
You haven't had any?
Flakes, literally flakes.
No, we have. My son's cadets events was canceled tonight.
Oh, wow.
Yeah.
We usually do. We get a lot of it, but
Hmm.
not tonight. I'm okay with that. Maybe it'll happen overnight.
Yeah,
Welcome,
hopefully
everyone. We're
not.
just going to give everyone a couple of minutes to join in, and then we'll get started. Yeah, I hope not too, because I have to go out tomorrow.
Is there any other areas not getting snow? I wonder if any of our. You have those moments sometimes when you have snow like this, it feels like you're in a snow globe.
Yeah, it's so pretty. As long as you're not driving, it's so pretty.
Or shoveling it.
We have somebody has a so Amadeep. I see that your phone. Oh, there it is. No snow,
Just,
just
oh,
rain.
rain.
We're not even getting that. It's dry here. Welcome,
Wow.
Nancy.
Nancy. Amandeep, do you have your hand up for us?
Don't know. Might have been a button on her phone because it's gone now. Okay. So it's 7:02. So I think we'll go ahead and start to make the best use of our time. We may get some more people joining in as we go along. But I'd like to welcome all of you here tonight to our WeLearn webinar at WeRPN. I'm Brenda Mundy. I'm the Program Manager for Professional Practice at WeRPN. Just before we start, we have a couple of housekeeping things to cover, and all of your speakers are muted, but we have allotted time for questions at the end. But what we'd like you to do, if you could just put them into the chat, we'll try and get to as many questions as possible towards the end. Somebody's trying to sign in. If you're here, you should be logged in. Anyways, so our land acknowledgement tonight is we're gathered here today virtually. However, each one of us is living on land that has been inhabited by Indigenous peoples for thousands of years. As settlers, we're grateful for the opportunity to be here, and we thank all the generations of people that have taken care of this land for so long. In particular, I'd like to acknowledge that WeRPN is located in Mississauga, which is the treaty and traditional territory of the Mississaugas of the Credit First Nation, the Haudenosaunee Confederacy, and the Huron-Wendat and Wyandot nations. So thank you for that. And I'd like to introduce our speaker tonight. Our topic is going to be about RPNs, strengthening impact and relevance of evidence-informed nursing practice. So it's a very exciting topic. And our presenter is Jen Calver. Jen is a registered practical nurse with a certification in gerontology. She has clinical, teaching, and research experience across various health and academic institutions. Jen is currently pursuing her doctoral degree in health sciences in research, in community, public, and population health at Ontario Tech University. Her doctoral research explores the psychology of health and safety of the workforce retention factors in long-term care. She also works closely with fellow RPNs and researchers to help strengthen the impact and relevance of research finding in a real-world context, which is really applicable tonight for us, through knowledge, skills, and experience of RPNs to advance nursing, policies, and healthcare to promote improved outcomes. Currently, Jen works as the WeRPN research coordinator. So welcome, Jen, and I'm going to turn it over to you.
Oh, thank you, Brenda. I just have some slides to share. Just bear with me. There we go. Can you see my screen okay?
Yes, we can see it.
Excellent. Well, thank you everybody for joining us tonight at this WeLearn webinar. I'm very happy to be here with everybody. we're going to talk about RPN strengthening impact and relevance of evidence-informed nursing practice. And I'm going to invite or encourage you to enter some of your emergent thoughts or ideas as they come forward. It's always wonderful when we get a group of RPNs together to share our knowledge and experiences. And if you're not quite comfortable to enter in the chat, we'll have a Q&A at the end, as Brenda mentioned, where you can send the research department a nice little email and we'll connect that way. So we're going to spend the next hour speaking about our evidence-informed nursing practice. And before we get started, I just want to ask all of us to take a moment to reflect and consider. What does evidence-informed nursing mean? Where does evidence come from? And why is there times when that evidence just doesn't seem to match our needs or the needs of the people in our care? So today we're going to speak about how we as RPNs play this critical role in developing, translating, and evaluating nursing knowledge to strengthen the impact and relevance of new and emerging evidence. So here's the questions that I asked you. And if you want to respond in the chat, that's wonderful. And if not, it's okay. We'll follow along and we'll go through it together. Let's look at the first question. What is evidence-informed nursing practice? So the definition that we're going to talk about today is the integration of the most informative research evidence with evidence from expert clinical practice, client preferences, professional clinical judgment, and other sources to provide the best possible care. And so what this does is that it's evidence-informed decision-making to provide a safety net for nurses and other health professionals, because it enables us to make accurate, timely, and appropriate clinical decisions. So where does this evidence come from? So nurses often refer to literature to help make decisions about that most appropriate course of action for a given situation. So for example, our nursing practice guidelines. These practice guidelines are developed from an accumulation of scientific research and available facts or information that emerge from our nursing practice. Research teams are comprised of subject experts. So this means that the members of the research team could include people with expertise in methods and methodology, or maybe they have expertise in a theoretical framework or a concept that they want to explore. But research teams also include people with real life experiences, so like us as RPNs. And often there's an administrative role or a research assistant to help keep all the pieces together. Researchers themselves and lead researchers are often people who hold a graduate degree at a master's or PhD level, although this may not always be the case. Generally, researchers work in environments or have access to research where they can continuously learn and build on their skill and really fine-tune some of those methodological techniques. So continuing on with where does evidence come from? There's many types of research designs that can be used to answer the research problem or question. So here on your slide is a 12-step research process. And this demonstrates the different phases and stages where we as RPNs can help to strengthen the relevance and impact of the evidence that emerges from research. So we start here. Nurses can identify the problem or issue. We know what we're doing in our day-to-day work. We know the interactions with the people that's in our care, the families that are around us, our interdisciplinary teams. And then we can go to the literature. Let's see what information is already available about the problem or issue we're experiencing. And sometimes that's enough. Sometimes that's where we're going to find our answer and be able to take it back to our practice and start using that evidence to move forward. There's other times where we're seeing this pattern or theme where there's a gap And having that information about what's in the literature will help us to define the problem. So it's a little bit more clear and it's a little bit more actionable. And that will lead us into developing a research question. And sometimes a research question, it could take several back and forth with rounds of literature searches to really fine tune what it is we're looking for. From our clinical skills, knowledge, and experience, we can generate a hypothesis for the outcome of the study. And then we get to choosing the study design. So here, often the principal investigator, so the lead researcher, will choose a study design with input from the rest of the team, the co-investigators on the team, and then the knowledge users, so our RPNs, can help to define the variables and other key terms. We have a very clear idea of the participants, the subject, or the population, and then you begin to conduct the study. When it comes to analyzing and interpretation of the findings, RPNs can help put that into a real-life context. So sometimes the language used in academia doesn't always translate very well into professional practice settings or contexts. And so when you have knowledge users, people that are actioning the evidence into practice, it can really help to enhance the applicability and the translation of that evidence into practice. So that's where we start to expand upon the findings and implement it into practice and start sharing, having conversations, and building out some of our practice resources. And then we can start again or move on to the next problem or refine the problem and go back to start again. I just want to take you back. On the previous slide, remember that we talked about evidence being developed from an accumulation of research. So when we are looking to use evidence in practice, we're going to want to continue to search for more than just one piece of evidence. There are multiple ways that we can implement evidence into our practice. So we might need to seek out more than that one source of information about a given topic. We know that as nurses, we must stay informed about current evidence to provide the most relevant and sound nursing care and use evidence to inform our practice. And so think about your current practice area. Think about the needs of the people you care for, maybe the documentation systems you're using, and some of the nursing programs and services you help to provide. We have nursing research is very useful to answer questions and find answers using a rigorous, systematic, or empirical approach. So the next few slides will offer some ideas and insights for why available evidence may not match our needs or may lead to some confusion about our roles. The information provided may not always be applicable to all situations. And I want to preface the next few slides by saying there is a lot of excellent nursing research that has significantly enhanced our knowledge and our practice as nurses. So let's talk about a little bit about why some evidence just doesn't seem to match our needs. We've heard that RPNs sometimes can feel unheard, underappreciated, undervalued, and underutilized. And one of the issues RPNs face is that there's an underrepresentation of our category of nursing in the literature. So this means that RPNs are telling us there's a lack of RPN expertise, knowledge to inform the evidence of clinical practice, client preferences, clinical judgments, health policies, and the list can go on. One thing to note is that the nursing profession is not a standardized profession. And what I mean by this is that vocational training differs for nurses across Canada and around the world, so particularly for the practical nursing workforce. And to add to this confusion, practical nurses in Canada are licensed practical nurses in all provinces outside of Ontario. And when the literature is referring to RPNs, They're speaking about the RPNs that are working in Manitoba, Saskatchewan, Alberta, British Columbia, Yukon, who are registered psychiatric nurses. So the way nurses are defined in the literature matters, as it can tell us the lens used to collect, analyze, interpret, and translate the findings into practice. So let's look at this article here presented on the slide as an example. One of the things that might pop out to you is the fact that the list identifies 4 categories of nursing. We see RNs, we see R or LPNs, RPNs, and NPs. So what's interesting about this is that we know in Ontario, our CNO describes Ontario nurses using 2 categories. So RPNs and RNs, with NPs being an extended class of the RN category. And we don't have registered psychiatric nurses here in Ontario. So looking in depth at how nurses are being described, which nurses were the focus, and who was involved can provide us with opportunities to critically appraise the evidence. A few areas of how nurses were described in this article really did stand out to me. And one is the attention to the fact that there's differences in educational preparation and scope of practice of practical nurses and RNs all across Canada. And this stood out to me. As much as the National Health Workforce and Nursing data will present evidence of Canadian nurses with little to no description or details of the jurisdictional differences. And they'll often report on LPNs. So they'll combine registered practical nurses and licensed practical nurses together. And sometimes we'll use a little asterisk or footnote to say that LPNs include RPNs in Ontario. RPNs in the National Health Workforce and Nursing data often refers to registered psychiatric nurses. So it's very important for us to understand the nursing population of interest when we're reviewing any type of literature looking to advance that evidence into our practice. The second item I want to draw your attention to is really important for all of us to consider, and that's the last 3 lines of this paragraph here. The core values of nursing remain the same for all nurses in Canada, across the globe. We can really see that the fundamentals of our practice is the shared core value in providing safe, compassionate, competent, and ethical care, promoting health and well-being, promoting and respecting informed decision-making, preserving dignity, maintaining privacy and confidentiality, and being accountable. So this slide shows another description of the Canadian nursing workforce that was taken from a nursing chapter of a textbook. And here, LPN is used to describe all practical nurses in Canada. Take a moment just to read these few lines, and I wonder if anything stands out to you in this description. And then I wonder, how might this description be taken out of context? And so I can't see the chat if anybody's entering anything into it. So Brenda, if there's anything there, can you just let me know and feel free to interrupt.
I will do. There's nothing here yet.
Perfect, thank you. So when we're reviewing practice guidelines or professional reports and other nursing resources, we want to start thinking about who was involved in the interpretation and translation of the evidence into practice. We want to think about how the evidence aligns with the RPN workforce in Ontario. We also want to think about how our profession is being portrayed to the public, and is that portrayal supported by evidence? So what I did is I quickly Googled one day RPNs in Ontario, and a few articles stood out to me. There was quite a few articles, especially I think over COVID. So I captured a few here for us to look at today. So this article Oh,
just to interrupt quickly, there was just one comment here from Jennifer, and it says autonomously and under direction seems like a contradiction in terms. She's so right.
exactly. Yeah, I love that comment, Jennifer, because that's exactly what hit my mind. And then I got thinking about this definition here. What happens if you were leading an interdisciplinary care team and you didn't have training as a nurse at all? And so you're trying to lead this interdisciplinary care team, and this is a definition that you came across. How would you arrange, members of your team? No, yeah, it's not very clear. Thank you for your comment, Jennifer. So we'll turn back to this article that's more recent, about 2023. And here it's talking about a woman poses as an RPN is charged with fraud. And so we know that nursing is a protected title under the Regulated Nursing Act. And in Ontario, only nurses registered with CNO can use the title nurse. And this includes us. It includes registered practical nurses. So that means we are recognized to have the knowledge, skill, and judgment required to provide safe and ethical nursing care. Thinking back to one of our first slides about evidence-based nursing, evidence is an integration from expert clinical practice, client preferences, and professional clinical judgment. And this tells us that RPNs can help to strengthen that impact and relevance of research findings. Here's another article. So again, we know RPNs are crucial members of the health workforce. This news article is, again, more recent, 2023, and it's reporting that RPNs are considering leaving the profession, citing reasons of job stress and unfair wages. During health workforce planning and development, experts turn to that accumulation of evidence to support their decisions. And here is where clear and accurate descriptions of RPN roles, their contributions and competencies in the literature is essential to inform change. Findings from research and evidence is translated into usable content and into different resources to provide evidence related to a specific topic. And we see professional associations, public and professional advocacy groups, some unions, collective bargaining agencies will create this collective voice to draw attention to a problem or issue, and will often use evidence to support their position. And facts and evidence about RPNs by RPNs can help to strengthen that impact and relevance of the research and the translation of the knowledge. When we look at this short clipping from the newspaper, we see 6 in 10 Ontario registered practical nurses are considering leaving. And that number just seems astounding. It's a big number. What we want to start thinking about with using evidence is we want to think about where does that number come from? So this poll was run by 2 unions, and we would have to do a bit more digging to see who was included. Did they only poll members within their collective bargaining agencies? Was a poll conducted at large hospitals or a certain setting? Did they include rural nurses that are working in Ontario? We want to start thinking about these things whenever we're referring to any facts or figures from the literature. And let's look at this media clipping. So this one's a few years old now. In 2020, a news release reported that 2 nursing groups raised concerns about the decision to expand the scope of practice for RPNs, stating that RPNs will seriously jeopardize the safety of the public. So if you can think, if our employers or policy decision makers are referring to any evidence that does not include RPNs or that poorly describes RPNs, misrepresents RPNs, then we can really see how this can add to some of the challenges we face in our jobs. So every day we go to work and we make a difference in people's lives. We are building professional relationships while ensuring that emotional and spiritual comfort. We're providing health teaching and education. We're contributing to the development, implementation, and evaluation of individual nursing care plans to help promote, maintain, and improve health, and help offer comfort and end-of-life care. We're participating in quality improvement and quality assurance activities. We're on work committees to improve care. We're participating in these proactive health and safety activities to protect workers, care recipients, and their families. We're building excellence in health and healthcare. And from our professional education and training, our experience, our continuous learning, we do have that specialized knowledge about our field of work. And many of us RPNs, we're just brimming with these thoughts and ideas for quality improvements. We have ideas for innovative solutions and enhancing nursing and care services. And sometimes our rich experiences that we have in our day-to-day practice fills us with so many ideas and interests that it can become overwhelming and we don't know where to start. Other times, we're sharing our ideas and there's moments where we can be shut down by others and it can start to feel a bit hopeless, or maybe that we're not worthy to be part of that change. But if we think about it, we're already part of that change. Each day we show up, each day we're connecting with people assigned to our care, we're collaborating with our colleagues and supporting families. Wherever our nursing role has taken us, we are making change, we are using the evidence, and we are valuable contributors to the nursing field. So throughout my nursing journey, I've heard many of my nursing colleagues refer to themselves as just an RPN. And I'm not sure if anybody online here today has found themselves uttering that word, but I have. And I was recently reflecting on this, is what makes us say that we're just an RPN? And for me, I'm pretty sure I feel that I used it often when I was working with people who didn't have much knowledge about the role of RPNs, or when I was working with people that I felt I had much more knowledge and experience than I did, ultimately feeling that low self-confidence or that less than feeling. I want to show you a short clip from a video. You might be familiar with Brené Brown. She's a researcher and a storyteller, and she studies courage, vulnerability, shame, and empathy. And in this video, Dr. Brown, who has 6 #1 best-selling books, she's presented one of the most viewed TED Talks of all times, and as a CEO, she speaks about a moment in her life that changed her in the face of criticism. So if you're okay, I will play that video. And I should let you know also that I think she does say a bit of a curse word there. So if you don't like that, then we can just mute our
So my
volume.
story is that I am a researcher, and I never thought I would have a big public career. And so I did a TED Talk that went very viral. And in the wake of that, I was kind of everywhere for a couple of months on every CNN.com, NPR. It was everywhere, and something I wasn't used to. Marching orders from my therapist and my husband were, do not read the comments online. So I read all the comments online. And so one morning I woke up and there were 2 or 3 new articles out, and I started reading the comments, and they were devastating. They weren't about my work, they were about me. They were super personal. And they were the things that creative people play in their mind and then give up doing what they really want to do. Like if I asked every single one of you, what would you try if you knew people would never say this about you. What would this be? Those were the comments that morning. Less research, more Botox. Just mean personal attacks, the things that really, up until that moment, had inspired me to stay very small in my life and my career, just so I could avoid those things. So that morning, Steve and the kids leave. I stay home. I get on the couch and I watch 8 hours of Downton Abbey. And when it's over, I don't want to turn off Downton Abbey. Because the minute you turn off Downton Abbey, then it's like soccer practice and dinner and back to the mean people. And maybe, should I get Botox? And maybe, maybe if I stand still when I talk. So I get out my laptop and I do a search for who was president in the United States during the Downton Abbey era. So I put it in and Theodore Roosevelt comes up and a quote comes up. And I read it. And this is what it says. It's a quote from a speech that he gave in the early 1900s at the Sorbonne. And a lot of people call it the man in the arena speech. And this is the passage that changes my life. It's not the critic who counts. It's not the man who points out how the strong man stumbles or where the doer of deeds could have done it better. The credit belongs to the person who's actually in the arena, whose face is marred with blood and sweat and dust, who at the best, in the end, knows the triumph of high achievement, and who at worst, if he fails daring greatly. So the moment that I read that, I closed my laptop, and this is what shifted in me. 3 huge things. First, I spent the last 12 years studying vulnerability, and that quote was everything I know about vulnerability. It is not about winning. It's not about losing. It's about showing up and being seen. The second thing, this is who I want to be. I want to create. I want to make things that didn't exist before I touched them. I want to show up and be seen in my work and in my life. And if you're going to show up and be seen, there is only one guarantee, and that is you will get your ass kicked. That's the only certainty you have. If you're going to go in the arena and spend any time in there whatsoever, especially if you've committed to creating in your life, you will get your ass kicked. So you have to decide at that moment, I think for all of us, if courage is a value that we hold, this is a consequence. You can't avoid it. The third thing, which really set me free, and I think Steve, my husband, would argue has made me somewhat dangerous, is kind of a new philosophy about criticism, which is this. If you're not in the arena also getting your ass kicked, I'm not interested in your feedback. We numb vulnerability. When we're waiting for the call, when we're trying to think about if we're
What did you think about that? When I listen to that, I think that facing harsh personal attacks on her character, Brene Brown came across an unexpected quote from a Google search that she felt changed her life. She began to reflect on who she wants to be. She tells us it's about showing up and being seen. She also tells us to recognize who is and who isn't in the arena with us, and that sometimes feedback and criticism may not apply to a given situation. And so when we're looking at sharing our knowledge to help strengthen some of the evidence that's out there and to increase applicability in our practice, it can create this feeling of uncomfort because we experience self-doubt or we want to make sure that we're doing the right thing. And I appreciate Brene Brown for getting up and talking about shame and vulnerability and letting us know that it is a human emotion and something that many of us experience. And for us, we're not just an RPN. We're RPNs with exceptional and significant knowledge, skills, and clinical judgment in nursing. We actively make efforts to maintain and enhance our professional practice to keep up to date with that emergent evidence.
People are really resonating with the quote. I just wanted to let you know, there's been a couple comments, people like, yep, she's bang on, she's got it.
Yeah. Oh, I look forward to reading your comments. And again, I invite you to reach out to the research department if you want to have any conversations about helping to face some of these barriers and challenges when we know we have that skill, knowledge, and judgment that would help support the program or project that we're interested in. So we also want to notice, so it's important that we continue to enhance our critical appraisal skills to continually enhance our understanding of using evidence in our practice. We want to notice how nurses are being defined in the literature. We want to know if RPNs in Ontario are accurately being represented, and if not, to consider possible actions that could help promote positive change in our workforce and for the people that we're caring for. So think about, what would you try if you knew people wouldn't respond with negative judgments or criticisms? So this slide shows some examples of nursing innovations that have improved healthcare and health outcomes. These nurses were inspired by their practice experience and used their knowledge to develop solutions they believed would be helpful. And yes, they faced judgment, criticism. Some of them faced multiple rejections. If you look at the second bullet there, she ended up giving away her innovation free of charge because she wanted to keep that focus on the innovation, on the feeding tubes, and not on her. We know that not all nurses will create the next innovative solution, but we're well positioned to build nursing excellence, apply that critical appraisal to evidence that we use, and share our nursing knowledge and experience to improve nursing practice, the care, and the outcomes. Who knows, when we think of our practice area and the things that we're doing in day to day, it's going to be quite exciting, or it is quite exciting to see what nurses are doing. I think the only thing on this list, as we read through it, I think disposable liners for baby bottles aren't in use anymore. But that's new, I think, in the last, if I were to hazard a guess, in the last 5 or 10 years. But to help war veterans feed themselves, this Bessie Griffin came up with feeding tubes. Anne Moore, Peace Corps nurse, she invented the first baby carrier, and it was because she wanted to bond with her baby while continuing carrying out daily tasks. And mothers just absolutely took to that idea. Anita created the crash cart in her basement, and they're everywhere. We have pain rating scales, color-coded IV lines, improved isolation gowns that are all still being used today. So we're promoting nursing and care improvements each and every day in our practice. And the knowledge, when we share our knowledge and just being involved, I was going to say when we get involved, but that's not true. We're already involved. We're already, every single day we're showing up. What we're seeing with the research program at WeRPN is that there's more RPNs participating in research and sharing these experiences and perspectives. Some of the topics that we're seeing RPNs participate in is around staffing, also a lot of the staffing challenges across sectors. We're seeing RPNs speak up, share their voice around internationally educated nurses, moral distress. We see a lot of rehabilitation nursing conversations happening and care of older people. When we're looking at RPN contributions in some of the ongoing research projects, RPNs are becoming more involved as members or collaborators on research studies, and they're really diving in to explore topics about inpatient geriatric rehabilitation, strokes, academic acute care hospitals. We're seeing palliative care for persons with dementia, hemodialysis, and RPNs in the operating room. And I think this list, it wouldn't all fit on a slide. There's a lot of areas that RPNs are really helping to strengthen the evidence. But even after the evidence is created, after the research finding is over, RPNs are really helping to apply that evidence in a real world setting. And that's where their day-to-day experience and context is really important throughout all aspects, whether we're creating new knowledge or helping to advance existing evidence. So to summarize, evidence is an integration of the most informative research evidence. Evidence is informed by an accumulation of scientific research and available facts and information that emerge from nursing practice. RPN's knowledge, skills, and judgments are needed to help strengthen that impact and relevance of the evidence. And there is opportunities available to RPNs to become participants of nursing and health-related research, to join a research team in various capacities, but also to learn to critically appraise research, to identify those gaps and opportunities related to our areas of nursing practice. And we're going to continue to celebrate nursing innovators, idea makers, change agents who make a difference in their work and in the lives of others. So before I sign off, evidence-based nursing connects research findings and theory to professional practice to guide appropriate care decisions. And so I wanted to share with you some of the opportunities that WeRPN's providing for RPNs that are interested to learn about research, or if they want to contribute as participants in research, enhance their critical appraisal skills, and really help to strengthen the impact and relevance of the evidence that guides our practice. For RPNs interested in contributing as members of a research study, you're going to be happy to know that there's 2 opportunities open for applications now until March 31st of this year. The first application, it's a call for academic research proposals. And so successful applicants of this academic grant must include RPNs throughout their study, and it has to align with one of the WeRPN research priorities. And these research priorities were identified by RPN members and RPNs across the province, as well as people who work with RPNs. And the engagement can take many forms. Some of our past funded projects have included RPNs as co-applicants, as knowledge users, so sharing their real life lived experience as part of the research team. They've been collaborators, research assistants. They're really fitting in multiple roles with these teams. The second opportunity is for RPNs to gain that real life research experience related to a topic of interest. And this opportunity is open to RPNs with no experience, some experience, or lots of experience in research. And here the RPN applicant will identify and work collaboratively with their mentor to identify the topic and learning objectives that is important to them and where they're at in their career. And the other components that are required for the application. So it's really a collaborative process. And so if you are interested in putting together a fellowship proposal, there is a brand new 2-part video series that's available on the WeRPN website. It has a case study, and it talks a lot about how to prepare to start your application, because sometimes that's the most challenging part if you're wanting to get involved in something like this. And there's lots of opportunity. If those 2 don't speak to you, you're welcome to come out and join us in our quarterly research webinars. We have information and resources that we're continuing to upload on the website. There is an 8-week e-learning course that's open. We're running one of the sessions right now, actually, and it's great. It's really great to see all the RPNs sharing their experience and how it fits with research. And it's really important. I'm going to encourage everybody to keep reading, stay up to date on some of these emerging evidence related to RPNs and our practice. And if you follow the bi-monthly newsletters from the research department or the monthly Pulse newsletters, it will help you to follow some of the trends and challenges that's being faced by our profession and some of the opportunities that RPNs are taking to be able to either drive evidence forward or help apply it into practice. And so I just want to thank you, everybody, for your comments. I'm going to stop screen sharing so I can see the chat. Don't hesitate to reach out to me at any time. I also have, if you have any professional practice questions, I have the info at WeRPN, an email there, or the research department there. So I will stop sharing. Thank you so much for
Jen.
moderating.
That was excellent. And there's a few comments in there. I think there's comments in there related to our novice nurses and how we support novice nurses. So when you talked about the study that was done about nurses intending to lead their profession, we did get a comment that the person does know of some fellow RPNs who have left, and it's very sad to leave a profession that you once loved. And this is true. And then someone else commented about the novice nurses experiencing stress with no support from other nurses who have the experience on the unit. And if I could change one thing in nursing, I think that would be it for me, is how we support our younger colleagues or our people who are new to the profession. You know, particularly people in my age bracket who are looking at potentially retiring in a few years. I want to make sure that we have that workforce. I want to share my knowledge so that the workforce coming up behind me, I feel comfortable leaving them, you know? So that'd be one thing I'd change. Maybe that's a research question. I know, right?
It really does, because we need each other.
We do.
One of the beautiful things about nursing is that, you know, we have these special practice areas and they complement one another so much. And when novice nurses are working with more senior nurses in a particular area, when they work together, it can just be beautiful and the care can be improved. Like there's just so many great things that can happen. I'm very sorry to all the novice nurses that are going through this.
Mm-hmm.
Yeah, unfortunately, it's not new, is it, Brenda?
It isn't new. I mean, that old adage about nursing eating their young, and I think it's hopefully changing a bit, but that would be, I just think, the one thing I would love to change in nursing or evolve. Don't think we need to change, because I think we have some excellent nurse mentors out there, and so if we could just grow that, would be great. Somebody else made a comment that, yeah, just an RPN devalues us as nurses. And I think you and I both 100% agree with that. But it's hard to stop your brain from using that language, isn't it?
Just an RPN? Oh, it's so hard. And, you know, I've been in rooms where I've heard RNs say that as well. And I've been in rooms where I've heard other members of the health profession say it. So yeah, if we can find a way to lift each other up and start looking at the challenges from the environments that we're working in and come together collectively, we're going to see change. And we have seen that. We've seen a lot of groups doing that together.
Mm-hmm. So there's a takeaway for us all, is to remove the word just from our vocabulary. That's a great one. Then some comments about Breen, is it Breen Brown?
Brené Brown.
Brené Brown, yeah. Very positive comments about her. And thank you so much, Jen. What is it that you are doing with your doctoral? And I would like to just comment, and I think that there is a misconception out there, and I think you're breaking through our preconceived notion, not our, because I don't, but some of the preconceived notion that in order to advance your career in nursing, you have to go on and be an RN. And you are living proof that there is lots to do in nursing in all categories.
Oh.
So what is it you're doing with your doctoral?
Thank you for asking that question. As a PhD student, I could talk about my thesis work all day long, and sometimes I do, and people glaze over because it is a big part of my life right now. But I want to start out, Brenda, by saying I couldn't have this pathway without my nursing colleagues. So I've been a member of WeRPN. I started as a nursing student. And when we used to have those big AGMs and conferences, and being able to connect with nurses outside of my organization to find out what's happening, I started picking up on themes that we were all experiencing very similar situations across the province. And we were all sometimes we had these different approaches, and you would be able to take home some of these evidence and elements and put them into our practice. So as a PSW and then as an RPN, I became very interested in the way we work and our working conditions. Sort of long-winded answer to your question, Jennifer. So for my doctoral work, I really wanted to look at the psychological health and safety, workforce retention factors for long-term care staff. Long-term care is my background, and there's a lot of talk about retaining nurses into recruiting nurses into long-term care. And we know that there's a need to retain them. And so my work looks at the conditions and creating healthy environments for nurses to work in. And I echo Dr. Pat Armstrong and her colleagues who say that when nurses are supported and the staff are supported, then everybody can get better care. And that's what it comes down to. So that's what I'm working on with my doctoral research.
Amazing. If anyone has any chat questions or comments, please feel free to put them into the chat. We've got another few minutes left. That's amazing what you're doing. And I think that this concept that, RPNs have been sort of underrepresented in the literature. And so to have you looking at the retention factors, but also keenly understanding RPNs and RPN practice, I think is really, really important. And I really liked the inventions, the nursing inventions, because I think for me, when I think of research, I think of the, multi-thousand participant double-blind studies, which is fantastic and needed, but it's not always needed. Sometimes it's those really what seemingly simple ideas where somebody sees a need and sees a way to fulfill it.
Yeah, the crash cart. I had a conversation with a nurse, Brenda, about the crash cart, and the nurse getting so frustrated that they weren't able to respond. Mandy's comment. If you're interested in becoming, I'm sidebarring again, sorry, I'm digressing. Mm-hmm. If you're interested in becoming a researcher, getting involved in research, reach out to us and we can help facilitate conversations with researchers and just help you get started in that pathway. There's a lot of opportunities, Mandy. I'd love for you to shoot us an email or anybody who's interested.
Yeah, that would be great.
Yeah, that crash cart, I was talking with a group of nurses who were really passionate about the development and the fact that she started that in her basement. And one of the things that was impacting the group of nurses I was speaking with was the fact that nobody knew it was a nurse. So according to this group of nurses, nobody knew that a nurse invented the crash cart. It's just starting to come out.
Wow. And yet, I mean, in this day and age, you can't imagine life in acute care without a crash cart, right? No. The organization in acute care that I worked in, and so you've given me a visual, because our crash carts originally were toolboxes on wheels, right? Those tool carts. And I just envisioned that that's probably something similar to what she had to work with in her basement.
Yeah, exactly.
Oh. So I had someone tell me years ago, say, why did you not become a nurse and continue your education? I said, I love what I am as an RPN, and I just need to, Tricia, I think that's a great comment, but you are a nurse. So anybody that tells you you're not a nurse, you are a nurse.
Absolutely. And I get that. Maybe not so much now, but when I was going through the end of my undergrad and into my master's, I was getting questioned a lot. How can you be doing this and say you're a nurse? Or how is this nursing practice? And it is, because when you're using your nursing knowledge at all, your skills, your practice, if you're using any of your fundamental training, you are nursing. Because clinical practice is huge for nurses, but we also contribute to education. We contribute to, there's so innovations. We just saw a whole list of nurses with innovations, policy, practice, advocacy. There's a lot of ways to apply our nursing practice.
Mm-hmm. Yeah, and it doesn't necessarily mean going to become an RN. There's lots of opportunities to continue your education,
Absolutely.
and continue to be an RPN. I think that's awesome.
Yeah. And if going through for an RN is your pathway, then I
I
100%
fully support
need
that.
our
Yeah.
RNs as well. Absolutely. Yeah.
I totally agree. There's, a need for all nurses, but you shouldn't feel that pressure. You should find the thing that makes you passionate like you have, and I think that's great.
Yeah.
Any other
I
comments or
really,
questions? Sorry, I interrupted you.
no, that's okay. I was just going to say, I really enjoyed this pathway because part of, I think if you attended the research symposium, you would have heard me say this, but we're always told to play well with others in the sandbox, to integrate different aspects of our care experience with one another, but we're not really told how to do that. And so by taking a pathway as an RPN and in immersing yourself in a learning environment with other health practitioners, you really get a good sense of the healthcare system and how nursing fits into it, and what we can do to help strengthen health and healthcare. Yeah.
Absolutely. Well, that's a nice comment. You're so supportive. Thank you. For people who are sort of at a crossroads, just kind of not sure where they might want to go, we do at WeRPN have career coaching that you can reach out to. It's available on the website, and set up an appointment with one of our practice associates and just have a conversation about what you might be thinking about. And we'll help connect you to the right people. If you're interested in research, we know somebody.
Really.
Great.
And yeah, I reshaped the professional practice team years ago. They're
Excellent.
helpful.
Great. Well, thank you so much, everyone. And thank you, Jen, especially for presenting tonight. I think you've given us some real insight about the role of RPNs in strengthening the impact and relevance of evidence-based nursing. I think this is just amazing. Thank you to everyone who spent your time here with us tonight. And I hope you join us next month on Tuesday, February the 20th at 7 p.m. when our topic's going to look at women and heart disease. It's an acknowledgement that February is Heart Month. So I hope to see you all then. Take care. Goodbye, David. Good night, everyone.
Good night, everybody. I look forward to hearing from you, Mandy.